Okay. All right, guys, this is going to be recorded. I'm sorry I didn't start it and I should have. I apologize. Um, all right, so now I'm going to go ahead and go on our next question. Let's see. So can you go to any doctor you choose if you're on Medicare? So, of course, um, doctors that you choose must, the answer here is false because you can't go to any doctor you choose. I was traveling this last weekend and I was speaking to a doctor out of California, and he said many doctors are choosing not to be involved with any type of insurance and their cash pay. So those type of doctors would not be covered under your Medicare. But the long answer here, the short answer is false. You can't choose whatever doctor you want to go to. The long answer is traditional Medicare covers all doctors who accept Medicare, but the doctors that are accepting Medicare must also be accepting Medicare patients. So a Medigap policy will also cover all doctors that accept Medicare, and Medicare Advantage plans have a network that you have to choose. So it's a limited provider network. Some Medicare Advantage plans are PPO networks. Um, there's some insurance companies that have nationwide networks that are very, very good. And so depending on, what type of services you need, if you need a Medicare Advantage plan, it's good to know that those plans are really a 1-year contract. Everything can change or things can change for the next year, and you should consider having an annual review. But the Medicare Advantage plans are usually have network providers, and if we had a different presentation, which I'll be giving another presentation. I have a 3-part series, and I'll be explaining the difference between HMO, PPO type in and out of network providers, HMOPS. But just so you understand, Medicare Advantage plans, you have to pay attention to network, you have to pay attention to if your doctors are in network, and you have to pay attention to if you plan on going out of the state for services. So if you do get a Medicare Advantage plan, it's just really important to make sure the doctors and the hospitals that you plan to use are covered. So the next question is, does Medicare cover long-term care? True or false? Unfortunately, they don't cover long-term care. The answer here is false. So the Medicare provides some skilled nursing, but it doesn't cover any custodial care, such as help with bathing, dressing, or other activities of daily life. But you can buy long-term care insurance. And just if you guys are out there and you're, considering, and long-term care is something that you really are concerned about, there's some great options out there. There's long-term care that can be added as a rider to life or annuities. And so just so you know, it kind of has a little bit of new spin on long-term care. Does Medicare cover dental care, hearing, or vision? So the answer is no, it does not, or false. It does not cover dental, hearing, or vision care. Now you can, so it doesn't care routine dental, teeth fillings, dentures, extractions, root canals. It doesn't cover any of that. But and it doesn't cover a vision, hearing exam, glasses, or hearing aids. But you can buy a dental add-on, and a lot of the Medicare supplements offer dental buy-ups, and if you were to take a Medicare Advantage plan, even some of those offer more dental, vision, and hearing than is just in the basic plan. So we're going to talk now about HSAs. So HSAs are health savings accounts, and I'm not sure how many of you are familiar with health savings account, but they're really you have to put so much money that the government tells you every year. So you might be able to put $4,000 for an individual into a health savings account, and then you might get $1,000 extra for a catch up if you're over 55. You put the money in there. If you don't need it and you're relatively healthy, you can just let it keep riding year after year and build up that health savings account. And then you can use it when you turn 65 to pay for Medicare premiums or other Medicare costs, such as deductible or coinsurance. So this is a great use of your HSA because it can pay your Part B premium also. So just so you know, I'm sorry, I should have said that sooner. The answer is true. So the HSA must be funded before you turn 65. So there's, you know, you want to start funding your HSA if you guys have children or anyone out there that, you know, might be a little bit younger. It's a good thing to do to fund an HSA. You can use your HSA money once you enroll in Medicare, pay for deductible premiums, co-payments, co-insurance. So while you're working, you can consider funding an HSA. Having a high deductible health plan makes you eligible for an HSA. So, and they're really expanding them in 2026. A lot of the insurance companies are bringing out more HSAs this year type plans. If you have any questions, put those into the chat. I have hsabank.com is who I like to use. Does Medicare cover equipment? So we're talking like knee braces, you know, wheelchairs, this type of equipment. And the answer is true. So Part B covers manual wheelchairs as durable medical equipment that your doctor has to prescribe. So, and it's for use in your home. If you were to need a powered wheelchair to be covered, however, you must have a face-to-face examination and get the written prescription, and it has to be medically necessary to have that type of wheelchair. You also must use a Medicare approved supplier, or if you have a Medicare Advantage plan, you might have to pay a 20% co-payment for medical durable equipment, and that 20% could be covered by your Medigap plan or your Advantage plan. So you have to kind of pay attention to this. If you do need durable medical equipment, a little note there, they do give you like certain number of equipment per year. So, you know, you can get 2 wheelchairs per year. They give you 1 wheelchair a year, knee braces, stuff like that. So the next question is, you and your spouse should plan on spending more than $250,000 out of pocket to cover healthcare costs during retirement. So this is a significant number, and I was actually looking this up, and it has gone up in 2025 from this number. But the answer is true. So even though you have Medicare, and you know it's really good coverage, there's a lot of people out there that are just ecstatic when they turn 65 because they might be paying extremely high premiums in their 60s for their health insurance. But even though you get Medicare, it still isn't going to cover everything. So recent estimates project that a couple who reach 65 and live to their average life expectancies, which was 84.3 for a man and 86.6 for a woman, they will need $280,000 to cover healthcare costs in retirement. The good news is for those people who saved for retirement, though your retirement planner that has shown you numbers that you need to have to retire has baked these numbers or put this in a formula so that the amount that you're told to save for retirement includes this number. So some people say, or the retirement planners say, you should save 8 times your final salary, but just to keep these costs in mind. So just so you know, some people are, they get to an age and they want to know, should I retire? Should I not retire? This is one of those things that you would consider before you made that decision. So the next question is, Medicare Part B helps cover the cost of prescription drugs. So the answer is false. So Part B covers services from doctors, preventative services, outpatient care, and other services. So to get your prescription drug coverage, you'll need to sign up for a Part D as in dog, plan, or have a Medicare Advantage plan, or have coverage from an employer-provided plan. So again, those prescriptions that you get at the pharmacy are covered under Part D. So just a little bit of clarification, if you were given meds in the doctor's office, those would be covered under Part B, like an infusion or something like that. So there are some drugs that are covered under Part B, but they're only while you're in the doctor's office or in the hospital facility. Next question. One reason to purchase a Medigap plan or Medicare supplement is to provide coverage for dental expenses. Again, that would be false. So original Medicare Part A and B does not cover dental care, and Medigap policies do not cover any additional services or care not already covered by Medicare. So instead, a Medigap plan helps you pay for certain out-of-pocket deductibles and co-insurances. So if dental insurance is important to you, then you need to buy a Medicare Advantage plan that provides dental, or there are Medicare supplement plans that offer buy-ups for dental. And so those plans have a limited amount of time that you can add those to your plan, or you can buy them during the first 30 days you take your Med Sup plan out. So if you need more information or if you have any questions, please feel free. Our next question. All Medicare Part D plans, or PDPs, are required to cover the same prescription drugs. Well, this would also not be true, so this is false. Medicare Part D options vary from plan to plan. So this is, again, Part D drug cards change every year. You're basically getting a one-year contract when you take that Part D drug plan out. Premiums for the coverage change, the formulary change. So each drug card has its own formulary, laying out the plan's list of drugs covered and the tiers of coverage. Drugs in each tier also have different costs, so consumers have to do some research to find the best plan. So it's really important that if you even if you take a Medicare supplement and you take a Part D drug card, it's really important that you pay attention to the drugs you're on, the plan you're choosing every year, and that's during AEP, annual enrollment period, that will be starting very soon, where you can make a change to your plan for 2026, and that is October 15th to December 7th. So this is our next question. Medicare Part B premiums can vary depending on your income. This answer would be true. So when you take your Social Security and you get your Part B, they're going to know how much income you make year after year. And so your Part B premiums will vary for reasons including your income. So according to Medicare and you'll pay the standard premium amount or higher if your modified adjusted gross income is reported on your IRS tax return from 2 years earlier above a certain amount. So you'll pay a standard premium amount. So this year it's $185. And if you have a higher income on their IRMA, which is income related monthly adjusted amount, then you'll get the extra charge on your premium. And I put the slide in here today so you guys could see this. So in 2025, those people that make under $106,000 as an individual or $212,000 as a couple will pay the monthly premium of $185. So if we look down at the next one, if you make between $106,000 as an individual and $133,000, or $212,000 as a couple, and up to $266,000 as a couple, then your monthly premium will go up by $74 and it'll be $259. Now, if you end up making between $133,000 individually and $166,000, then your Part B monthly premium will double to $370,000. So this tool is available to you guys. We're happy to share it. I just think some people don't realize that based on their income is their Part B premium. Our next question is, Medicare only covers stays in nursing homes in limited situations. False. Lots of people think that if you have to go to a rehabilitation center, which is like an extended stay one, after surgery or illness, that Medicare will help you pay for it. Well, that can be very expensive for you because the answer is not always yes. So Medicare will cover semi-private rooms, meals, skilled nursing, rehabilitative services, and other medically necessary services and supplies after a 3-day minimum hospital stay. So if you go to the hospital and they keep you overnight and they say we need to put you in a nursing home, then you're obviously going to it's not going to cover it. So you have to have a 3-day minimum. So that means like outpatient surgery for knee replacement, stuff like that might not qualify. So the inpatient hospital stay has to be related to illness or injury. Additionally, coverage only continues for up to 100 days, with the first 20 days being fully covered and days 21 to 100 requiring you to pay part of it. So after 100 days, then you're totally on your own. So this is, if you guys, it's kind of complicated, but if you want any more explanation, I can give that. Our next question is, can I delay enrollment into Parts B and D if I do not plan on taking Part B or D until I'm 67 years old? I do plan on continuing working. I am self-employed business owner with 2 employees. I will not incur a late enrollment penalty. So the question here is, this person wants to not take Part B or D until they're 67. They want to continue working. They're a small business owner. They're self-employed, but they only have 2 employees. So the question is, will they get a late enrollment penalty? The answer is false. Oh, they will not. So the answer is they will not. So they will get a late enrollment penalty. Sorry. So they will incur a late enrollment penalty in this situation, because to delay enrollment without penalty, you must have credible coverage. So let's talk about what credible coverage is. Credible coverage is insurance coverage that is equal to or better than your coverage from a large employer with 20 or more employees. The late enrollment penalty is a fee that is added to your monthly Medicare premium for failing to enroll in Medicare when you were first eligible. Once incurred, the fee lasts as long as you are enrolled in Medicare, which is usually the rest of your life. So this can be a costly mistake, you guys. So our next question is, each year during the annual enrollment period, or AEP, a Medicare beneficiary can change their Medicare Part D plan. This answer would be true. I think we already went over this a little bit earlier. Medicare Part D prescription drug plans can be changed during the open enrollment period, which is October 15th to December 7th. Medicare Part D prescription drug plans can change the covered medications from year to year. So it's crucial that each year you make sure the plan that you're on still covers the prescription that you're needing for the following year. It's also time that you can shop for more cost-effective plan. It's just important that when you're on these types of plans that you take advantage of this open or annual enrollment period. So if you were on a Medicare Advantage plan, and let's just say you didn't do anything during AEP, there is such a thing as OEP that you can make a change. But on a drug card, you only have AEP. So I just wanted to make sure I note that. So I hope everybody's following me, and I hope I hope this is engaging enough to keep you guys enjoying this. So our next question is, once you choose a Medicare plan, will it automatically renew? Yes, the plan will renew. So your choices stay in place year after year unless you make a change. So this makes sure that your coverage continues, but benefits and costs can't change. So your premiums can go up on a Med Sup. Your Medicare Advantage plan benefits can change. They do send you an annual notice of change. So if anybody here is on Medicare already and they have a plan, they're required to send you an ANOC, annual notice of change, before open annual enrollment period. So it's important to review your Medicare choices every year during the medical annual enrollment period, or AEP, which is the 15th to the 7th, to make sure you have the coverage that fits your needs. Next question. If you are retired and receiving Social Security benefits, you will automatically get Medicare Parts A and B when you turn 65. So let's see. If you already have your Social Security, you already got to get Medicare, you already have A and B. So that means when you turn 65, according to the Medicare and You book, if you're already getting benefits from Social Security or Railroad Retirement Board, you'll automatically get Part A and B starting the first day of the month you turn 65. So if if your birthday is on the first day of the month, then your first start date for Medicare will be the first day of the prior month. So if you're under 65 and disabled, you'll automatically get A and B after you get disability benefits from Social Security or certain disability benefits for the Railroad Retirement Board for 24 months. So after 24 months, you will get your Part A and B on either those two situations. A red, white, and blue Medicare card should be in your mailbox 3 months before your 65th birthday or on the 25th month of your disability benefits. So the answer is true. So I think that's all I have today. If anybody has any questions, I would be happy to answer any questions. I want to thank you all for attending. I just want to make sure that you know that we're here for you. I want to be your resource. You're welcome to call our office. Our office, just in case you don't have it, is 248-362-4050. We cover the whole state. So National Benefit Plans is not only in the whole state of Michigan, but if you were to move to another state, we have a number of retirees that we still insure or that we help nationally. But we are no cost to you. We don't even mind answering questions. We are just a great resource of knowledge, and we're always really grateful to help you in any way. And this was a 30-minute presentation. It looks like I did really good because I'm right on time. So kudos to me. But if you want me to reach out to you, or if you want to email me, my email is Vicki@NBPlans. You're always welcome to send me any type of questions or information. And I'll be happy, even if you just have a question, please, we would love to help you out. So I hope everybody has a great night, and I want to thank you for attending. Thanks, guys. I appreciate it.